February is Children's Health Insurance Awareness Month. We proclaimed this, if you will, 7 years ago when we started our Children's Health Insurance program, the CHIP outreach in 5 school districts here in Hidalgo County, which are now, we're working with 11 school districts. The idea is to raise awareness primarily among the parents of students in the schools, but also include all the community in this effort. And the reason for this is because we've seen so many changes in the CHIP program over time since it started, that we see too many children losing coverage and too many families who are discouraged. Children's Health Insurance Awareness Month is a good time to remind parents that CHIP is a great program and that they should be signing up eligible children and using the benefits for healthy children.
75. Sí, su pregunta de CHIP, ¿cuál es? ¿Está aquí en Macale? 1-1. Okay.
So with them, we feel that we could be losing as many as 2,000 children a month. We've even seen this, children's Medicaid is impacted. We have 24,000 less children enrolled in children's Medicaid than we did 6 months ago. That's unconscionable. How in the world can we have the poorest of the poor without coverage?
Can you prove that it's not that those parents are earning more money now and therefore don't need, the children don't qualify?
It could be that if they are earning too much, they would automatically go to CHIP, because I don't know how many low-income families get that kind of raise. You would have to go up a considerable amount of, your income would have to go up considerably to go from Children's Medicaid to CHIP. But you would go to CHIP. You wouldn't get dropped off.
But maybe you move up to CHIP, and then the CHIP families also move up out of everything.
Then we should be having 24,000 more children on CHIP. If they're moving off of Medicaid and going into CHIP, those numbers should reflect it.
And they're not.
And they're not. Okay. Well, what we're also seeing, Steve, is that we had a conversation, a phone conference with a staff from HHSC about outreach about 8 or 9 months ago, maybe even a year. And we talked about, we have a working model here. We have a best practices model in outreach through the school systems. We feel that it's the strongest way, the best way for families to learn about this coverage and for them to be able to apply. It is a system that works, and we're very proud of the work that we've accomplished here. We're extremely proud of the partnerships that we've established with the districts and their interest in making this a sustainable outreach program. We tell this to the state. We try to convince them to come down here and look at it, and we try to make them see how it can be implemented throughout the state so that it works. They haven't come down yet. So you wonder, why are you insisting on something that doesn't work and not bothering to look at something that does? Now, when we talk about the school system, we're also talking about communication between departments. If HHSC and TEA were to look at the children in our schools and look at 100% coverage for those who are eligible, we'd have a lot less expenses out in the emergency rooms. We would have a lot more healthy children in the classrooms, and it is so simple to do. It's mind-boggling to me. If you're able to go into a database and identify uninsured children, if you're able to train parental involvement staff and nurses who are already doing the work, this is no addition to their budgets. It's simply an addition to what they're doing, a different way of what they're doing. And every one of them has been willing to go that extra step. So we feel that outreach by the state, they need to talk more to the community partners. They need to see how they can best invest their dollars with community partners who already know what they're doing, who already have the established connections within their communities. I'm a big believer that we have in our community what we need to solve our problems, and that our tax dollars are there for us to be able to do this. So it's a matter of us getting together and saying, this is what works, let's do it.